Hi Michelle, so we're at the end of week 2 of the pain course and we've got week 3 coming up. So how has week 2 been in the pain course this week?
So week two's been great. We have had some good comments. The discussion forums have been a little bit quiet this week, which is something that was a little bit better in week 1. So I'd really, for moving on to week 3, I would really kind of advocate that you get in on discussion forums and have a chat to each other about the content that you've read about. But yeah, overall it's been a good week.
Good. And yeah, so week 2 was all about psychological basis for pain and persistent pain and why persistent pain occurs. I think that the discussion forum on explaining persistent pain to your patients, that's a really key discussion. So if people out there do have, people on the course, if you do have a way of that you find effective to explain persistent pain to patients, then please do share that with everyone, because I think that'll be really useful. There's always some useful comments, some useful ideas that come from everyone and how they work with their own patients. So please do get into that discussion forum and share your knowledge on that. So yeah, what's coming up in week 3?
So week 3, we're moving on to the assessment of pain and looking at outcome measures as well, because it's obviously important that we're measuring how effective we're being in treatment. And assessing pain can be quite difficult. As physiotherapists, we like to get our hands on and have a look at people doing and the movements and whatnot. But I think with chronic pain, it's a little bit different, and it's about taking that step back and just having a listen to the patient really. So we've got a couple of book chapters to have a read through, and we've got a good couple of journals to have a look at on outcome measures. Again, it's quite an interactive week. We've got a couple of discussion forums, which again, I'd really advocate using, getting on discussion forums and have a look. We've got a discussion forum on having a look at doing a literature search and having a look at outcome measures. And doing a review really. We've got a couple of pages that might help you with that, because literature searching can be quite a tricky one to do, but it's a vital skill as clinicians to to keep up to date with current evidence. So I would have a look at the Physiopedia page that we've got. That helps with literature searching, which will help you find a little bit of evidence. And also we've got the critical analysis tool, which will help you pull apart the paper and see whether it's a good paper or not. So I definitely encourage you to have a good go at that. And if you struggle, pop some questions in the discussion forum. We do literature searching all the time, and we can always help you.
Yeah, good. So we're starting out with assessing pain, just some tools and techniques to assess pain, and looking at outcome measures, which will be great. And then using the discussion forum, and we've also got a video with Daniel Harvey, haven't we? So I spoke to Daniel this week. He is a researcher in Australia who is doing some research into using virtual reality with persistent pain patients. So he's a really nice, it's really nice talking to him. He kind of bridges the gap between week 2 and week 4. So moving from pain science into treatment. So he has some nice ideas for assessment. And also his work has some really good clinical applications and kind of indications to help our understanding of why persistent pain occurs. So Daniel's a really good interview to listen to. His work is really interesting, it's fascinating, so that'll be good this week. Yeah, and I think that's everything for week 3. So hopefully by the end of week 3 we'll have a way to assess our case study, and we'll be thinking about how we're going to treat our case study, ready for the treatment week in week 4.
Yeah, and also if you've got any extra questions, pop them into the week 1, any specific questions, because we're lining questions up to maybe send over to Tasha as well. So
so we'll be using your questions, sending them to Tasha, speaking to Tasha next week, and getting any answers that you need to get from one of our specific topic specialists. Great. All right. Well, thanks, Michelle. We'll see everyone, and Michelle and I will be in the discussion forum again. So have a good week.